Pulmonary arterial hypertension is similar to if you took a garden hose and you kinked it and it would push pressure back into the heart, into that right ventricle. If you have a sudden release of pressure, then I pass out. It can build the pressure up too high dangerously. Okay. The diagnosis came because I was short of breath, and so if I had to encompass it in one word, I would say, well, sometimes I'm short of breath, and nobody can predict when or how that's going to happen.
So pulmonary artery hypertension means the blood pressure in the lungs is very high, and normally the blood pressure is low because you only have air that you're pushing against from the heart to the lungs. So when it's high, the heart has to work very hard to deliver oxygen to all the muscles and the rest of the body. And so patients start struggling because the blood pressure is getting too high, and it makes the heart fail, the right side of the heart, because you have two parts of the heart, the right and the left. The one this primarily affects are the ones in the lungs and the right heart.
My knee-jerk reaction was, my first initial knee-jerk reaction was that God's got this. This is easy for him. But I think that anybody who will tell you that's all they think of is probably lying to you. As with any kind of disease, whether it's temporary or permanent, comes a grieving process, very much like grieving a death. That you know that some things have been eliminated from your life, that there's loss of this, loss of that, and you do have to grieve through that process.
A lot of times we don't really know. It could be genetic or hereditary. So some families have it, and there's some genes that are associated with the genetics of the disease. Sometimes it's from patients who have a disease like autoimmune, like scleroderma or lupus or rheumatoid arthritis or mixed connective tissue disease, because they all have a lung pathway. Sometimes it's from drug use. We have an epidemic in Arizona of patients on methamphetamines, and it can raise blood pressure. So stimulant use, cocaine, illegal drugs can cause it. Another thing that can happen is you can get it from having blood clots in your legs that go to the lungs, and you can have a high blood pressure in the lungs from that. Sometimes people have other diseases like sarcoidosis, or something that specifically affects lung tissue that can raise pressure. But when we're talking about the arteries, there's a lot of it is idiopathic, meaning we don't really know. We don't know why certain patients get it. One day they get it, they have a heart cath, we measure the pressures and it's high. And when we go through all the questions about how they could have gotten it, they answer no to everything. And if we can't find a genetic or a hereditary reason, we call it idiopathic, meaning we don't really know why somebody has it, but we have to treat it.
Changes that have occurred in the last 3 years have been that I find it more difficult to park close enough to a building to walk in. I find it difficult to shop for groceries in the summer because already by 6:37 in the morning it's too hot. Heat makes it more difficult for the body to absorb oxygen. So any oxygen-related issues would be encompassed in that question. I recently had to hire somebody to clean my floors at my house. If I bend over below my knees, I get very dizzy and feel like I'm going to pass out.
Most of the time, people don't know they have this problem until they can't do their normal activities, and the number one is shortness of breath. They start feeling they can't get enough oxygen to do what they need to do. Where they normally might have been able to walk and go upstairs with no problem, that starts becoming hard because they have a difficult time exchanging oxygen. So the big one is shortness of breath. Sometimes they can get some chest pain. Sometimes they can get dizziness or lightheadedness and feel faint because the oxygen's not going up to their brain. Sometimes they feel weak or fatigue, a lot of fatigue in their muscles because they can't get enough oxygen there.
Some symptoms I experienced. In the last year, I have passed out twice. So anything that if you would indicate a sudden drop in blood pressure, okay, that's like when you flush the toilet and the water goes down, then you have no pressure to get the blood up into the brain. Yeah. The first medication they put me on that did fairly well was Opsumit, also known as Macatintan, and it is a endothelin uptake antagonist. And then recently here, within the last 4 months, being put on Orenitram, which is treprostinil, which is a vasodilator. And it's kind of tricky because the vasodilator, I have to take it 3 times a day with food. And so you kind of have to make sure you work that into your schedule. Like it or not, that's what you're going to do. I went to the doctor once a year, occasionally twice for something. A couple of those maintenance checkups that we do as we get older. And I just counted, in the last year alone, I'm spending an average of 20 hours a month with medical. I've had 5 surgeries related just to this disease, including an implant, and look this up, this is a great one. St. Jude Loop Monitor. It's just like your USB thumb drive. It's planted in the chest near the heart, and it tracks the beats in the 4 chambers of the heart. So what they discovered through that is that I have atrial fibrillation. This is different than ventricle fibrillation, will kill you for sure. Atrial fibrillation, the fibrillation means that the heart kind of shudders. And so in that process, it's not really getting the beat through. Since being on the treprostinil, which is the vasodilator, that seems to have subsided to some degree. The other procedures, of course, constant EKGs. I had a VQ scan where you have to inhale nuclear medicine and hold it in your chest, and they scan you. 2 right heart catheters, 2 angiograms, and a partridge in a pear tree.
So the first thing is we try to determine why the person has it. We try to figure out all. So a whole bunch of testing has to be done. We screen them for things like lupus and rheumatoid arthritis. We do a test to make sure they're not having blood clots over and over again to their lungs. So we might do something called a chest x-ray and a VQ scan. Sometimes we will screen somebody for all their work chemical exposures. We might ask them if they've worked in a factory, have you been exposed to something that can destroy or cause high pressure in the lungs, like some chemicals can. We get drug history, even if they had, not knowingly, there was a diet drug that a lot of women used called fen-phen. Fen-phen was a diet drug that might have caused this problem in certain women. The other thing we might do is we will bring them for an ultrasound of the heart, and they might have an echo, and that ultrasound will tell us what's going on with the right heart and the function of the lungs. If it looks like this is from artery hypertension, I will bring them to the heart cath lab, and they will have a procedure where I actually put a balloon with oxygen sensors at the end of the balloon to measure how high the pressure is to confirm they have that diagnosis. And I will take oxygen from each part of the heart, and I send it to measure where, if they have any holes in the heart. Sometimes children can have this if they're born with holes that raise the pressure. After I determine that they have this disease, we have to initiate therapy, because if you don't treat it, patients die. So from start to finish, you can have a couple of years before they start having any therapy at all, that their lungs and heart just fail. And without it, they can need a heart transplant or a heart-lung transplant. So you really want to get them diagnosed early.
Yeah, absolutely. On a daily basis, I feel that. For one thing, I had to quit a full-time teaching job, which I really adored, because, the 60-hour demand was just too much on me. And even with that, I could have added in a second job that would have paid me another $38,000 a year more than what I'm making now teaching part-time. Furthermore, I can no longer go hiking, mountain climbing, fishing because you have to go someplace to get the fish. Hunting, yes, I do like to go hunting. I can't travel above 5,000 feet, so I can't visit my relatives because they all live above 5,000 feet. My faith in God, the knowledge that He has already healed me. Just as when I received a cancer diagnosis, I knew I was already healed, and today I have no more cancer. Even though the only care that I get from the doctors that the medical community is able to give me at this point, from a scientific standpoint, is what they call palliative. Well, we'll see if we can help you get through the next day. We'll give you some pills that'll maybe make it for you. But I believe that God has something great every day, that He's great every day, and that my purpose has not been diminished because of this disease, and that I can go on with my life and fulfill my purpose.